Hello, my name is Dr. Smita Jha. I am a pediatrician and neonatologist currently working in a small district, Samastipur, which is in Bihar. I have done my MBBS and MD and further fellowships from Pune and Oxford University, the John Radcliffe Hospital and Newcastle Hospital in United Kingdom. And then I moved to my birthplace to serve people here. So, having worked there and then moved towards this small district, I have known few challenges of the rural area patients. So, I'm going to talk about the healthcare needs of the patient in this rural area because most commonly I deal with lower and lower middle class patient in my district, and I'm going to talk with some points in that. So first and foremost point is the availability of the specialist doctor itself. It's a big challenge. So it's still a big need for such a small place to have a specialized doctor. Very few doctors are specialized. By that I mean is you can get lots of MBBS doctors, but the specialist like neonatologist and pediatrician, the proportionately they are less in our area. So we need more and more specialized doctors. Second, and the most challenging part is the finance. So first part of that finance is the patients are very poor, and if you ask them to do a very expensive tests, they are not available in government sector, and for private they are not, they cannot afford that. So the health insurance part needs to be more stronger than what it is right now, and the network needs to be more stronger. So the which hospital they cover, it needs to be more stronger. uh, Continuing with that, the lab facility also, because sometimes we do request for some of the very basic tests and they are not available in such a small city, which obviously restrict our diagnosis and then our treatment of that critical patient. And then finally, in unfortunately in most of the cases where such challenges are happening, we need to refer them to tertiary centers, which are obviously in Patna. So the lab sector needs to be more stronger and more established. This is the third point. Another point which I can think about is networking of doctors itself. So a single hospital, if they have lots of multi-specialty doctor, the patient does not need to move here and there for each and every small thing. So that networking needs to be more stronger. These challenges, we understood them more clearly when the corona pandemic occurred, because then we realized that these are the challenges which might restrict if we have overload of patients as we had in that period. Um, Another thing which I personally feel as a pediatrician is the services like physiotherapy or rehabilitation is still not fully established in a rural area where patient cannot take it on regular basis at this village or district level. So that needs to be improved. These are the few problems and few needs of healthcare sector, needs of the patient, which we might need to improve more near future. This is my personal view. So thank you very much for listening to me.